Hi, Dr. Dave Webster again on my video blog about the travesty of PET in Ontario, and this is some case examples to demonstrate the Ontario Liberals' egregious and politically motivated assault on our cancer patients. And I want you to keep in mind that just by revealing you these cases, I am being threatened by the senior executive from Cancer Cure Ontario and the Registrar of the College of Physicians and Surgeons. So this is my first case series, and just a bit of background because we're going to be talking about lung nodules. So if you had a chest x-ray and you had a lung nodule, which we would define as a mass in the chest 3 centimeters or less, if it's larger than 3 centimeters, we would call it a lung mass. Now, this chest x-ray would have about maybe a 30% chance of being cancer. Now what you could do is you could, and of course in the 90s you'd order a chest CT, but in fact the rest of the world decided long ago that's not the best way to go. And in fact the U.S. insurance companies won't even pay for a CT exam. What they will pay for, however, is a PET CT, which contains the CT component, but as you can see, a lot more information. This isn't the same mass, but this here shows sugar uptake in this mass, and this is virtually certainly lung cancer, but you can see there's already spread to the lymph nodes here, because they know why won't they pay for the CT, but the PET CT, because very clearly the rest of the world's known for a very long time, up to 20 years or more in the case of lung cancer, that doing this test is the most likely way to advance the management of that patient, which would be that clearly that patient needs a biopsy. But in Ontario, the Liberal government absolutely demands that patients absolutely have to have a CT. So this isn't the same CT of that, but if you look at it again, here you see there's a little about a 10 millimeter mass in that left lung here. Okay, so what'll happen, because this patient has the misfortune of living in Miswins, Ontario, is they're going to say, well, we don't know if it's a cancer or not. We'll do another CT maybe in 3 or 4 months, and they'll keep doing that serial CT exams every 3 to 6 months. And these patients, I assure you, many of them are just outright destroyed. Their lives are on hold. They can think of nothing else. This is an enormous stress. On top of the stress is, well, gee, if this really is cancer, what does all this delay mean? And in fact, it may be 1 to 2 years if you live in Ontario, before the radiologists decide, based on the changes on the CT, that, gee, maybe it is a cancer, and so on. Remembering that if in Quebec, the same situation, or Paraguay for that matter, within 6 to 7 weeks, if you had the PET CT, if it was cancer, you'd be on appropriate therapy. So now that the radiologist, after all this time, has decided you need a PET CT, would you get one in Ontario? Not a chance, because this is not what Ms. Wynne and the Liberals want for you. You will absolutely have to have a biopsy of this mass before you can have the PET CT. So remember that up to 90% of OHIP-funded PET CT exams are for lung nodules and lung cancer. They are the exact opposite indications of the entire world body of expert opinion. The effects on our patients are devastating. It truly is an assault, as you will see, and I'm going to give you some case examples. So the first one here is an 84-year-old male. He had a chest x-ray and a mass, and they decided it might be cancer, so he had to have that compulsory CT guided biopsy, and it confirms that it is a cancer. Now, this is the FDG PET scan, the brain up here. This is the mass. This is an aggressive lung cancer, and already the PET showing us, and these were described on the CT, that these are cancer as well in what we call the mediastinal lymph nodes. So because they live in Ontario, you can see this big needle here. That's going to have to be shoved through that patient's chest, and you can imagine, they freeze the skin, but this is an uncomfortable process. You're in and out of a CT scanner multiple times, and it is an extremely stressful situation for the patients themselves. But the PET scan showed something that the CT didn't report, although it's on there, this little spot here. What might that be? So let's take a more careful look. This is the patient's left scapula here. This is the spine, the back of the patient. This little spot here almost certainly is a spread of cancer to that bone. And obviously, flipping the patient on their stomach, we could do this on your kitchen table, and biopsying that would have been far better for the patient. Minimal risk, or virtually no risk, and an exponential reduction in discomfort and stress to the patient. And by the way, we would have appropriately staged this patient as stage 4, which the CT, because they missed that lesion, didn't do. So the next patient is an 83-year-old male, again, lung mass, has to have the biopsy, and sure enough, this is his FDG PET, just as the left lung, right lung. This is a very large cancer enveloping the arteries and bronchus here, a very bad situation with this patient, but because he lives in Ontario, he has to have that biopsy. But let's just take another look at what the PET shows us here. And this is the trachea. This is the clavicle. This is the left clavicle. And right sitting next to it is this little spot right here. We call it a Virchow's node. I had a diagram of this before, but this is at the base of the patient's neck. Imagine how easy that would be to biopsy. Why not biopsy here? Because the Liberal government doesn't want you to have the biopsy there. You have to have the biopsy in your lung first. So this is Premier Wynne. This is the new Minister of Health, Dr. Helena Jazik. She won't get back to me. Dr. Hoskins had to be forced to get back to me. He's bailed, possibly, seeing the writing on the wall. But for reasons known only to them, they've decided that you absolutely have to have a biopsy. They want you to have a biopsy. They don't want this test that the rest of the world would do. And this approach of multiple CTs over time and so on leads to delays which are often fatal for patients, gross overexposure, unnecessary radiation, huge increase in unnecessary stress to these patients, and of course excess taxpayer costs. And this is of course courtesy of Cancer Care Ontario, Our Future Built with Health, with Care, and of course McMaster, their colleagues at the Evidence School Base of Medicine, only too happy to come up with the answers their political masters need. And this is, by the way, what Ms. Wynne means by putting patients first in Ontario. So my project is that, we again have to make this an election issue. I assure you this is not going to happen from the press. I've spent the last 15 years letting the Liberals get away with this. So we need to use, social media on steroids. So I am not for any political party after dealing with them for my 30 years or 40 years now of medicine. But what I'd like you to do is, any way you can possibly do so, contact the people and the politicians running in your jurisdiction, no matter who you favor. If it happens to be the PCs, then obviously you can get a hold of Doug Ford through his Twitter account. This is Mr. Jeff Urick, possibly our next health minister. I've actually spoken with him and met with him, and I really believe he wants to do this. If it's the Liberals, again, here's the contact information from Ms. Wynne, and now the other Minister of Health, Helena Jazik, the physician. And when you're contacting them, one of the things you might ask them, if you see my other videos, is why have they taken such care to have such contempt for especially our breast cancer patients in this province? You might just ask them that question. And finally, if you're an NDP person, this is Meth Horwath, and this is their health critic, Franz Jonas from Sudbury. But you know what? I wouldn't even bother. This is the so-called party of the people. The NDP I've dealt with more than anybody over all these 15 years, because the past two health critics have actually been from Sudbury, and I assure you they've known every last detail from day one, and they absolutely will not touch this. So it's an election coming. This is my website. That's my Facebook page and my Twitter account, which is now up and running. There's my email if you want to contact me. Bottom line is that if we miss this opportunity with an election coming, I will just have to continue to advise my patients. If you or a loved one gets cancer, you need to leave this province immediately. So please, let's do this for the cancer patients and other patients, as you will see, uses for PET like dementia, head injuries, and so on. Thanks a lot.